Hey, what's up, nation? Today we're going to be talking about TRT, also known as testosterone replacement therapy or androgen replacement therapy. And before we get started, guys, this red mark right here, I was doing some heavy push presses, and that's what that's from. It's from the gnarl of the barbell, because I know you guys are going to ask me down in that comment section below. But the reason why we're talking about TRT today is because this is something that has started to come up a lot in the comment sections of my recent videos, because we've been talking about the effects of steroids, and many of you are confused about what exactly is the difference between TRT and a steroid cycle that bodybuilders use. So in this video, we will be covering symptoms of low T, how low T is treated, benefits of TRT, and the risks involved with TRT. But before we get started, let's discuss the basic breakdown of why people often turn to TRT. The most common reason why people turn to TRT for help is because they suffer from a disease called hypogonadism. Hypogonadism is a disease in which the body is unable to produce normal amounts of testosterone on its own. This is either because there's a problem with the testicles themselves or the pituitary gland that controls the testicles. Now, there are ways to naturally raise your testosterone levels, and I actually made a video about that, which I will link to down in the info section below, called Testosterone: How to Optimize Your T Levels Through Nutrition and Lifestyle. You should always have these natural ways to raise your testosterone levels in check to maximize your testosterone production and obviously your gains. However, if you're doing everything right and are still experiencing symptoms of low T, which we'll be discussing in a bit, you should get checked out by a professional. Also, guys, just to knock this question out before I get asked, no, testosterone boosters are not the same as TRT. If you want more information on testosterone boosters, I will link you guys to my video in the info section called The Truth About Testosterone Boosters. But in a nutshell, testosterone boosters are over-the-counter supplements made of herbs, vitamins, and minerals that claim to naturally raise your testosterone. TRT is very different, guys. This is because TRT is prescription testosterone that you use when your body doesn't produce enough. Very different. Now, testosterone boosters can have their place under certain circumstances, but like I said, if you want more information on testosterone boosters and if they really work, check out the video down in the info section below. Remember, guys, this video is about testosterone replacement therapy, and if you can't seem to raise your testosterone levels naturally, then TRT may be something you should consider, and you should have a doctor prescribing the treatment and monitoring your progress. So, how do you know if you have low testosterone? Well, let's go over the symptoms. Some of the most common symptoms of low testosterone are muscle loss, weight gain, low sex drive, feeling irritable, getting tired easily, hair loss, low sense of well-being, poor energy levels, and even difficulty concentrating. In fact, normal average testosterone levels in males is between 270 nanograms per deciliter and 1070 nanograms per deciliter, but these levels decline as you age, so the older you are, the more important it is to monitor your testosterone levels. So if you're noticing any of these symptoms, you should get a blood test done to see if you're suffering from low testosterone. The last thing you guys want to do is self-diagnose by injecting yourself with illegal steroids and risk messing with your hormones and making things even worse. Big no-no, guys. But let's say you saw a doctor and he determined your testosterone is low. Well, how is low T treated? Well, once you do your blood work and the doctor determines that your testosterone levels are low, they will prescribe TRT or testosterone replacement therapy in order to bring your levels back to normal. But don't think your doctor is going to get you to Olympic bodybuilder status, guys. Doctors typically only prescribe low amounts of testosterone just to supplement your current levels to keep you in that normal range. So don't think that once you start TRT, you're going to become a Greek god and get huge. TRT is only used to bring you back to normal levels, which for most guys is going to be between, like I said, the 270 and 1070 nanograms per deciliter. To see massive gains from steroid use, you would have to be closer to 3,000 to 5,000 nanograms per deciliter. So as you can see, it's a pretty big difference. Now let's talk about some of the most common ways TRT is administered. One option is a skin patch, and there are different types of patches that are used on different parts of the body. For example, Angioderm is a skin patch worn on the arm or upper body, and it's applied once a day. And there are also scrotal patches as well, which are placed on the testicles. But the downside is that those tend to irritate the skin. Next is gels. And testosterone gels are typically applied once a day and have a near instant absorption rate which lasts throughout the day. Some come in packets of clear testosterone, and some come in a pump that delivers the amount of testosterone prescribed by your doctor. But the downside to these is that they can be very dangerous to the rest of your family if they're exposed, often causing unwanted hair growth in women and early puberty in kids. Another option is a mouth patch. These are actually tablets that stick to the upper gums. They're applied twice a day and continuously release testosterone into the blood through the oral tissues. But the downside to these is that people often complain about having a bitter taste in their mouth and in some cases irritation to the gums. There are also testosterone pills, but like we have discussed in earlier videos, pills are one of the worst ways to boost testosterone due to their liver toxicity. And lastly, guys, you can do injections or implants. As we know, testosterone can be injected directly into the muscles or even implanted as pellets in the soft tissues, allowing your body to slowly absorb the testosterone into the bloodstream. So what can you expect from testosterone replacement therapy? Well, the truth is the results will vary because it largely depends on the individual. In general, men who've used TRT often notice an increase in their testosterone levels to about 500 to 600 nanograms per deciliter, which is right in the middle of the normal range. And because of this boost, a lot of men report improvement in their energy level, sex drive, and quality of their erections. It has also been reported that TRT treatments have helped increase bone density, muscle mass, and insulin sensitivity in some men as well as an overall improvement in their mood. But like I said, guys, everyone is different, so you won't really know how you're affected until you try it. From what I've seen, licensed professionals say that typically about 1 in 10 men notice a major difference, while the rest notice a difference, but it isn't this huge life-changing thing for them. Now let's talk about some of the most common risks and side effects of TRT. And some of these common side effects include rashes, itching, or irritation at the site where the testosterone is applied. There also have been reports of an increased risk of heart attack or stroke, but we don't really know the benefits or risks of long-term treatments of TRT because large clinical trials have not been done yet. However, there are a few health conditions that experts believe testosterone therapy can worsen. The first is benign prostatic hypertrophy, and for most men as they age, their prostate grows larger, and TRT can actually make this problem even worse. And what happens is this results in the squeezing of the tube that carries urine, making it even harder to urinate. Which is if you were like me when I was a kid and never knew what the heck Derek Zoolander's agent was talking about when he was trying to pee while on the phone talking to Mugatu, well, now you know, and so do I. And TRT can make this problem even worse. And while we're on the topic of the prostate cancer is another risk. This is because testosterone can actually stimulate prostate cancer to grow in males who are already diagnosed with it. This is why seeing a doctor is so important, and you should never self-diagnose low testosterone because men with prostate cancer or a predisposition for it could make their situation much worse. Another risk has to do with those of you who have sleep apnea, which is actually something I know about because my dad has it, and this is when your breathing is interrupted when you sleep. Believe it or not, you'll literally stop breathing repeatedly during sleep if you have this condition, and it can be worsened by TRT treatments. Blood clots are another concern, and the FDA requires that testosterone replacement products carry a warning about the risk of blood clots in veins. The problem is that testosterone can increase the risk of a potentially life-threatening clot that occurs in the lungs, or it can increase the risk of blood clots in general. The reason for this is because TRT treatment can cause an abnormal rise in the number of your red blood cells. And lastly, we have congestive heart failure. And if this is something you're currently suffering from, then you should not take any kind of testosterone replacement because it can worsen this condition as well. Unfortunately, guys, it will be probably years before large clinical trials are done to shed light on the long-term benefits and risks of TRT. But just like any other kind of treatment, it will be up to you and your doctor to discuss the possible risks and benefits based on your current medical condition. Now, there is one more thing I want to discuss before we end this video, and that's testosterone replacement versus performance-enhancing steroids. A lot of people seem to think these are the same thing, and I want to take the time to clarify the difference between TIT and juicing. People say all the time that because doctors prescribe TIT, that taking anabolic steroids in the form of testosterone is perfectly safe. Wrong, guys. Like I said, TIT is prescribed at very low levels and in a very safe and controlled environment to bring your testosterone back to normal levels. The difference is that when you're on steroids, you're taking huge amounts of testosterone, which bring a much higher risk and super magnified side effects like testosterone converting into estrogen, which can lead to man boobs as well as strokes, heart attacks, etc. Think about it like this. Take a look at the side effects of TIT and understand that the amount you take will help keep you within the normal range of 270 to 1070 nanograms per deciliter, with most men ending up usually around 500 to 600. A cycle of steroids will take your testosterone levels as high as 3,000 to 5,000 nanograms per deciliter, and if you do the math, you should understand that all the above risks will be greatly increased. Now also factor in that the testosterone athletes take is usually illegally produced with questionable practices at best, and then combine that with all the other drugs they take, because when you're on steroids to compete, you don't use just testosterone. Testosterone is just a part of an overall stack which includes many other high-risk drugs. But the most important message I want to drive home when comparing TIT versus performance-enhancing steroids is that when you're on TIT, your body is already not producing enough testosterone. So the additional amount is just helping you achieve natural levels of the hormone in your blood. When you're on anabolic steroids, chances are you're already producing normal amounts of testosterone, so the excess testosterone that is injected will cause your body to back off its natural production, and in some cases, it will stop your testosterone production altogether. So guys, these are two very different things. I hope this video really helped clear things up a lot for you guys about what TIT is and if it's right for you. At the end of the day, go see your doctor and discuss this treatment in depth with them, because if you're going to decide to do it, you want to make sure you're doing it safely. And the last thing you want to do is quit fitness because of something you have no control over. So make an appointment and get your testosterone under control. Also guys, if you missed my last video on Trenbolone, I will post a link in the info section below, and I know a lot of you have been asking when the clenbuterol video is coming out, and that will most likely be next week. Be sure to hit that like and subscribe button, get those gains, and as always, more good stuff coming soon. See you guys.
Go.